Hi, my name is Lisa McAfee. I'm going to be talking to you today about the Diagnostic Criteria Assessment and Treatment for Autism Spectrum Disorder. I chose to talk about autism because I myself am autistic. Hello. I was only diagnosed at age 37 after my children were diagnosed, and I found that this helped explain a lot of the difficulties and challenges that I have faced in my life. And I was since become very passionate about education and advocacy for autism and autistic individuals. So I'm going to share slides. To be diagnosed with autism, a person needs to have developmental difficulties with social interaction, social communication, and behavioral processes. So A1 is social emotional reciprocity. We have challenges. So when somebody asks, how are you, for example, we might actually tell you. We can be oversharers. Sometimes we have an inability to initiate or reciprocate conversations or play for younger people. We have difficulties reading societal cues for expected behavior. We can have face blindness. We can be blunt. So this is comedian Hannah Gadsby saying, I find it very difficult to connect to others because my brain takes me to places where nobody else lives. We also have nonverbal communication challenges. So this is A2. We can avoid eye contact. We can have a flat affect. Sometimes while we're listening very carefully, we'll engage in routines that make it look like we're not paying attention, but we are. Diagnostic criteria A3 is deficits in developing, maintaining, and understanding relationships. So this says that guy wanted to buy you a drink. Really? But I already have a drink. Do you think he'd buy me mozzarella sticks? We can be blunt or direct, not as sensitive as neurotypical populations. Some of us won't tell white lies, guilty. We can lack attributed function to small talk, guilty. 60% of autistic children have language problems and receptive and expressive language skills. So this is a meme saying, team, I can hear the near silent hum of electrical appliances and the bubbles fizzing in the can of soda on the coffee table, but I can't watch TV without subtitles and process conversations at 1/4 speed. This is quite typical. We have communication challenges with neurotypicals, but typically not with other neurodivergent people. So this is an interesting challenge. Many of us are very aware that we experience these challenges and we miss social cues and we say things that can be offensive and we can't stop it. So many of us have a large degree of social anxiety because of this. And many of us are very literal minded and we have difficulty with theory of mind. So we'll take a sarcastic or mocking compliments and we think that they're sincere, for example. Other diagnostic criteria is 2 or more restricted repetitive behaviors of behavior, interest, or activities. Excuse me. So B1 is stereotyped or repetitive motor movements, use of objects, or speech. Many autistics will speak in movie quotes, for example, when they are stressed. This is echolalia. Many of us have stims, physical tics related to excitement or stress. B2 is insistence on sameness and flexible, adhere to routines or schedules. So we often eat the same meals over and over again because they're comfortable. We have routines to be able to function. B3, highly restricted, fixated interests that are abnormal in intensity or focus. We call these special interests or hyper-focus ability. B4, hyper or hypo-reactive to sensory input. Sensory triggers are different for everybody, but may include sense, sounds, crowds, lights, vestibular or temperature discomforts, or visual sensations. Overstimulation can result in meltdowns. When we are approaching a meltdown, we might start to stim. This may be the only communication we're able to give you that we are having a difficult time. So if you find your neurodivergent person in a dark room, do not turn on the lights while asking, why are you in the dark? We're not lost bats. We know how light switches work. We can even answer questions if you give us a minute. Many of us will go to a sensory closed place to try to recover when we're reaching burnout or meltdown. Diagnostic criteria C, this must be present in early developmental period, but it may not become manifest until social demands exceed limited capacities. And this may be masked by learning strategies later in life. So this is an example of me getting ready to act normal at work and then me after work, after a hard, long day of pretending to be neurotypical. This is exhausting for us. Diagnostic criteria D, symptoms cause clinically significant impairment, such as work or relationship difficulties. And then diagnostic criteria E, these disturbances are not better explained by intellectual disability. So this is a chart. People think autism is like this, low functioning or high functioning, yes, no, or we're all a little bit on the spectrum, quote unquote, but it has to cause significant impairment in our lives, and there's many different aspects of being autistic. So how do you diagnose autism? What are the assessment strategies? I personally really like the Autism Spectrum Quotient. It's not an official assessment measure, but it's a self-assessment, reasonably reliable. Also for children, more typically is the Autism Diagnostic Observation Schedule, ADOS. It assesses communication, social interaction, and play. There's a couple others, there's many others if you are interested. Evidence-based treatment and interventions for autism. Please consider ABA very carefully. We are not animals. We don't need to be trained. Please do not suppress our stims. This is how we get out our anxieties. So please give us therapy, not training. So examples of therapy: speech therapy, excellent. Nonverbal communication can be taught. We can comprehend expression and language use. We can learn how to self-advocate, use captions, ask others to speak clearly and slowly. Autistic communities and social groups can be fostered. Occupational therapy can be very useful to help us learn our triggers and help us deal with the things we experience. Another would be to get women diagnosed. Women or girls who are diagnosed with ADHD, anxiety, or depression, please look at autism. Many of us would benefit from autism assessments. 87% of autistics have a secondary mental health concern. Please treat it. We have lots of things going on. Autistic folk are much more likely to be gender diverse, experience gender dysphoria, be transgender. Please help us with that. Last, we have a lot of strengths. Our passions, our interests give us insight, and we have an exhaustive ability to focus on these issues that we're passionate about. I run an Affirming Neurodiversity at Weebly.com website. Let's all be kinder to each other, and thank you for your time. I hope you have a great day.